Smoking. The cultivation and use of tobacco plant has origins in Central America. By the 15th century, the tobacco leaf had reached Europe mostly to be smoked in pipes or as cigars, but increasingly considered as a cure-all for many common conditions. With the mass production of cigarettes and invention of the match in 1800s, smoking became available to many people. It has become easy and affordable. By the 20th century, cigarette smoking has advanced greatly and its availability has increased as well, especially to the troops during the two world wars. However, in the 1950s, it started to be recognized just how dangerous cigarette smoking and the inhalation of cigarette smoke was. Composition of cigarette smoke. More than 4,000 harmful substances are found inside a cigarette smoke, and this includes acetone, ammonia, arsenic, butane, cadmium, hydrogen, cyanide, methanol, naphthalene, toluene, and vinyl chloride. But for our discussion, we will only be concerned about three. The first one is known as tar. Tar is blackish in color and is considered as a carcinogen. Carcinogens activate oncogenes and can facilitate mutation and causes cancer. Number 2. Nicotine. Nicotine is a drug component of a cigarette. This has a very fast absorption rate and travels to the brain. This triggers release of dopamine, which is a neurotransmitter, making it pleasurable for the smoker. Thus, in consequence, it makes it very difficult for the smoker as it becomes a pleasurable experience to them. On a physiological perspective, it reduces arterial and releases a hormone called as adrenaline. And lastly, nicotine increases the risk of blood clotting. The last component is called as carbon monoxide. This one is taken from cigarette smoke. Carbon monoxide has a higher affinity with hemoglobin than oxygen. This means that carbon monoxide will bind more readily than oxygen in red blood cells. We have to note that carbon monoxide is colorless, odorless, tasteless, and is a flammable gas that easily diffuses across the alveoli and into the blood. When carbon monoxide and hemoglobin combines, they produce a stable compound called as carboxyhemoglobin. This compound is very stable, which guarantees that it will linger in the blood for a longer time. Too much inhalation of carbon monoxide can lead to asphyxiation or carbon monoxide poisoning. Chronic obstructive pulmonary disease, also known as COPD, is the name for a group of lung conditions that cause breathing difficulties. This include emphysema and chronic bronchitis. Emphysema is a lung condition that causes shortness of breath. The lungs is constantly infected and requires phagocytes for defense. Phagocytes leave blood vessels but requires release of elastase. Elastase destroys the elastin. Since elastin is destroyed, alveoli cannot expand as we breathe in and cannot recoil back when we breathe out. This increase in air pressure in the alveoli leads to bursting. If more alveoli burst, surface area of gas exchange is reduced. Bronchioles collapse and traps air in alveoli during exhalation. Number of capillaries decreases and leads to lower oxygen in the blood. As oxygen in the blood is low, patient's body would try to compensate it by rapid breathing, which often leads to an enlarged right side of the heart. Diagnosis is confirmed with the help of medical history of the patient, like smoking habits and exposure to smoke or cigarette. Symptoms, physical exams as simple as walking or listening to the heart, and x-ray. Treatment includes lifestyle change, medication, oxygen therapy, pulmonary rehabilitation, or lung volume reduction surgery, which removes worst affected areas of the lungs. Next one is called as chronic bronchitis. This is the inflammation and irritation of bronchi caused by tar that stimulates goblet cells and mucous glands to enlarge and produce more mucus. Mucus cannot move and accumulate, slowly blocking airways. Mucus would often contain dirt, bacteria, and virus. Stimulates smokers' cough as they attempt to remove the accumulated mucus. The damaged cells are replaced by scar tissues, and the smooth muscle becomes thicker, making it more narrow and more difficult to breathe. As such, pneumonia will develop far more easier. Symptoms include severe cough, large quantities of phlegm, which is mucus with bacteria and white blood cells, shortness of breath, and tightness in the chest. Diagnosis is confirmed through medical history, symptoms, and several lab tests that include lung function test, X-ray, CT scan, and blood test. Treatment includes lifestyle change, medicine, oxygen therapy, and lung transplant. Lung cancer is caused by the tar that contains carcinogens. This reacts directly with the DNA and causes mutations. Uncontrollable cell division leads to tumor. Second tumor may occur. If metastases occur, do note that it is difficult to detect tumor cells unless it reaches 1 centimeter in diameter. Detection includes bronchoscopy, X-ray, and CT scan. Common symptoms include coughing out blood due to tissue damage, chest pain, and difficulty in breathing. It includes surgery, radiotherapy with anti-cancer drugs, chemotherapy, and lung removal.